Good morning, everyone, and welcome to the digital launch event of the Cancer Nursing Fund. The Cancer Nursing Fund is managed by the King Baudouin Foundation. My name is Lydia Makaroff. I am the patron of the Cancer Nursing Fund, the chief executive of Fight Bladder Cancer, and the president of the World Bladder Cancer Patient Coalition. We have an exciting program for you today. We have speakers including Professor Christine Comien, who is the vice chair of the Cancer Mission Board. We have Mr. Robert Green, who is a cancer patient and founder and chairman of the Hunger and Thirst Foundation in the Netherlands. We have Natalie Mole, who is the Director General of the European Federation of Pharmaceutical Industries and Associations. Dr. Andreas Karumbus, who is Associate Professor Oncology and Palliative Care and a board member of the European Oncology Nursing Society. We have testimonials from participants of the EONS conference who have benefited from the Cancer Nursing Fund. And finally, the current president of the European Oncology Nursing Society, Mr. Johan Damant, who will speak about how to support what you care about. So now I will introduce Professor Christine Comien. So Professor Christine Comien is a professor of cellular biology at the Université de Paris in France. She is currently vice chair of the Phase 1 Mission Board for Cancer at the European Commission. She was director of research and innovation at the French National Cancer Institute and director of the Cancer Institute of the France Research Organizations. She has served on many scientific and clinical commissions in France and Europe in leukemia, immunology, oncology, and stem cell research. She's the author of more than 270 peer-reviewed publications and has received several scientific and French governmental awards. Dr. Comien, the floor is yours.
I would first like to thank the European Oncology Nurse Society to give me the opportunity to highlight the work the first Mission Board on Cancer achieved, to give advice on how to tackle cancer through the new mission concept. EU missions start from the idea that complex societal challenges require a coordinated effort across Europe to deliver impact. The European Commission identified 5 societal challenges that could benefit from the mission approach, such as cancer, but also climate change, clean soils and clean oceans, smart city. In the first phase of the mission's work, the Cancer Mission Board finished its work and handed its report to Commissioner Gabriel in September 2020. The report is a summary document reflecting a strong consensus, a strong support from all the Cancer Mission Assembly members, the European members of the Parliament, member states representatives, and more than 100 stakeholders that were consulted or that gave their input spontaneously. This included patient organizations and also the European Oncology Nurse Society. So in line with the mission approach, the Mission Cancer has a measurable target that is achievable in a given time. The target is to improve the lives of more than 3 million people by 2030 through prevention, cure, and for those affected by cancer, including their families, to live longer and better. The report highlights 13 recommendations in 5 intervention areas: prevent what is preventable, increase early diagnosis and treatment, improve quality of life for cancer patients, cancer survivors, and also cancer patient carers. All this with a goal of equity for all citizen and patient and a better understanding. The report led to a strong commitment during 2021 from the Commission and a concrete Cancer Mission implementation plan that was published last October, and also a strong work plan of the European Beating Cancer Plan. The specific actions have started to be rolled out following various EU programs, Horizon Europe, but also EU for Health. The mission actions will answer the Mission Cancer Board recommendations in the 5 intervention areas. The actions that are already out in calls highlight the need, for example, to define new metrics for the measurement of quality of life, to describe new screening methods and new types of clinical trials. The Mission Board has recommended that the successful implementation of these recommendations will also have to lean on actions dedicated to increased training, increased dissemination of information, and of course, to increase the number of all the stakeholders that are needed to solve these actions. The mission approach states the need to co-construct with citizens, patients, and carers. As a past hematologist, I know how much nurses, whether at the hospital or at home, are the persons that patients and carers see more often than oncologists. They are more trusting in their questions, more at ease, ask for explanations. Active participation of nurses in the mission actions will be determinant as a means to ensure active participation of patients and their carers. So in conclusion, this era is a novel era for the fight against cancer, and such a strong commitment at a high level is an opportunity that we should not leave behind. The mission concept is a novel approach of our way of doing things, and I believe should be a step of transforming cancer culture. The challenge we face now is how to get the individual citizen, the patient, aware of the mission's actions and how to get involved and feel happy to participate at local, regional, and national level. This meeting is certainly a step in the right direction. Thank you.
Thank you so much, Professor Comian. If you would like to join the conversation, you can use the hashtag Cancer Nursing Fund on Twitter, and you can also tag at Cancer Nurse EU. Also feel free to introduce yourself in the chat and raise any interesting items or questions in the chat. Next, we have Mr. Robert Green. He is a former healthcare professional as well as a colon and prostate cancer survivor. He advocates for patient-centered and patient-centric approaches to the entire cancer pathway. He is an active spokesperson for a personalized approach to nutrition for cancer patients. He is the founder and president of the Hunger and Thirst Foundation in the Netherlands, as well as a Conquer Cancer, ASCO Foundation's Grant Selection Committee member, a member of the European Cancer Patient Coalition, and as well as a European Cancer Organization Patient Advisory Committee member. Mr. Green?
I applaud and support the launch of the Cancer Nursing Fund. Oncology nurses face cancer every day, and to do this requires both strength and knowledge. My name is Robert Green, and I am an ex-colon cancer and ex-prostate cancer patient. On behalf of cancer patients, I would like to give a special thanks to our cancer nurses for all their efforts to help improve treatment outcomes, your tireless support in enhancing our quality of life, whilst helping us deal with both diagnosis and treatment. The Cancer Nursing Fund will help cancer nurses to have more access to education, sustain the development of research, enhance the capacity building of cancer nurses in Europe, and support the development and dissemination of innovative methods of cancer care and cancer prevention. Cancer nurses play a significant role in the journey of every cancer patient. The role cancer nurses play often goes beyond the patient by offering support to carers, family members, and friends. A cancer nurse must understand the pathology results and the implications, and have an in-depth knowledge of the expected side effects of cancer treatment. With this knowledge, the cancer nurse can use interpersonal skills to listen to patients, assessing their understanding of the disease and its process, and the patient's emotional state. Treatments rapidly advance, and oncology nurses need to pursue continued education. The Cancer Nursing Fund will play an important role in granting more access to education. Cancer has a significant impact on our lives as survivors and patients. The relationship between patients, their families, and oncology nurses call for just as much passion as it does experience. Together with the Cancer Nursing Fund, we can help cancer nurses care for the more than 3 million citizens who will receive a cancer diagnosis this year. Thank you.
Thank you so much. Next, we have Ms. Natalie Mole. Natalie joined the European Federation of Pharmaceutical Industries and Associations as Director General in 2017. Prior to joining FPIA, Natalie was the Secretary General of EuropaBio, ranked as the most effective European trade association in Brussels in 2013. She spent over 20 years working for the bio industry at EU and national level in associations and corporate positions, and held the position of Chair and Vice Chair of the International Council of Biotech Associations. In 2013, Natalie won the Televisionaries Women Innovation Award, organized by Women and Technologies. Natalie was also named one of the 15 leading women in biotech in Europe in 2017 and recognized as one of the 20 women who shaped Brussels by Political Europe in 2020. Ms. Mole, the floor is yours.
Good morning, everybody, and thank you very much for inviting me to join you for the launch of the Cancer Nursing Fund. On behalf of EFPIA, the European Federation of Innovative Pharmaceutical Industries, it really is a pleasure and honor to join you today, even though it's only in a digital format, and I really would have relished the opportunity to meet you and see you face to face. Over the past nearly 2 years of this pandemic, I don't think the role of nurses has been lost on anybody. I can't believe how much healthcare professionals have had to endure and have offered to keep us all alive and healthy. I know that without the tremendous role that nurses have played and continue to play in our healthcare systems, we all as a society will be in a much darker place. I have my very own personal reminder just here of my mother, who passed away in February last year and was a Red Cross nurse for the largest part of 40 years. So I know very well the sacrifices that nurses make for everybody else's livelihood, but also the incredible passion and dedication that you put into your work. A few minutes will really never do justice in terms of time spent highlighting and praising the role of nurses in general, and especially also in treating cancer patients throughout Europe. Our role as the research-based pharmaceutical industry is to develop new treatments that constantly aim to keep cancer at bay, to delay its progression, to improve the daily lives of people with cancer, and in some cases to manage to cure it. But our innovation would be meaningless if it didn't reach the patient at the right time and in the right way. And I think it's hard to understate the role of nurses in the patient treatment pathway from both a technical point of view and an emotional and human point of view, to ensure that the treatments that a patient receives is holistically integrated in the care that they receive in their whole pathway. Nurses are really often the first line of dialogue with the patients. They are, if you will, the human face of a healthcare system and of all the things that we put in place to try and help patients. As frontline professionals, nurses play a key role to support the communication between patients and physicians, especially when treatment regimens are set up, modified, or changed at any moment. But their role really extends much beyond this. In some countries, nurses are equal partners in the treatment panels, where they decide together with the doctors, carers, hospital administrators on the best treatment and care for any particular patient. I think this pandemic has highlighted, hopefully, even more the role of nurses in our healthcare systems, and more so the need for continuous training and education of healthcare professionals, as well as maintaining flexibility in healthcare systems and supporting nurses. It is really fantastic to see the establishment of the Cancer Nursing Fund as a means to enhance the education and tools at disposal of nurses. And I look forward to hearing more about the activities of the fund. Please rest assured that as EFPIA, we stand ready to continue our collaboration with all stakeholders in the healthcare systems for the benefit and continuous improvement of care for cancer patients in Europe. And we look forward to continuing to work with you as well. Thank you again for inviting me, and have a great launch.
Thank you so much, Ms. Mole. Next, we have Professor Andreas Karumbus, who obtained his Bachelor of Science in Nursing Science from Northumbria University, his Master's in Nursing Science and his PhD in Oncology Nursing from Middlesex University. He is the Vice Chair of the Nursing Department at the Cyprus University of Technology, where he works as an Associate Professor of Oncology and Palliative Care, and he also holds the position of Adjunct Professor at the University of Turku in Finland. He is the founder and past president of the Cyprus Oncology Nursing Society, former president of the European Oncology Nursing Society, and president of the European Cancer Organization. He is also the founder of the Cancer Nursing Fund. He's involved in national and international research programs in various fields of cancer care and has published over 150 national and international publications in esteemed journals. Professor Karumbus, the floor is yours.
Hello, my name is Andreas Karumbus, and I am an Associate Professor of Oncology and Palliative Care and co-founder of the Cancer Nursing Fund. Well, welcome to everyone to this virtual launch of our Cancer Nursing Fund. The fund was created back in 2020 under my mandate as President of the European Oncology Nursing Society, as a response to the increasing need to support nurses on one hand, and to advance the profession of cancer nursing across Europe on the other hand. Nurses often work in exceedingly demanding settings, which require highly educated, well-informed, and competent cancer nurses. Unfortunately, the opportunities for nurses to support and advance their professional development are not always available, and at best, not accessible to the majority of the nurses in the field. This creates an imbalance between the high expectations required by the nurses and the limited resources that are made available to them to meet their roles in full. Therefore, knowing the great impact that cancer nursing and nursing in general can have on the patient lives and beyond, we have created the Cancer Nursing Fund with having a look at the present and certainly an eye for the future. Through specific activities, we envision to provide nurses better access to education in order to improve cancer care across the care continuum, to sustain the development of research carried out by cancer nurses and promote participation in multidisciplinary research, to enhance the capacity building of cancer nurses in Europe, supporting participation in conferences, and to support the development and dissemination of innovative methods of cancer care and cancer prevention. A diverse array of activities has been planned to support this vision, which will include, for example, the support of the nurses to attend to high-level European and international conferences, undertake specialized capacity-building programs, support innovative research studies through pump priming grants, just to name a few. Taking this opportunity, I call on everyone to embrace this initiative. Together, let's strengthen cancer nurses to improve patient care and recovery across Europe. Together, we can. Thank you.
Thank you so much. Next, we have Johan Damant, who is a proud cancer nurse and president of the European Oncology Nursing Society. Johan has been a registered nurse in oncology hematology for 21 years and an individual member of the European Oncology Nursing Society since entering the profession. In 2010, he transferred to the Ghent University Hospital Cancer Centre to work as a nurse consultant in the hematology stem cell transplant unit, and has since expanded his expertise in patient education, supportive care needs, adolescents and young adults with cancer, transition and survivorship care. He was a board member of the Belgian Society for Radiotherapy and Oncology Nurses and is an active member of the Belgian Hematology Society Nurses Committee. He is currently Cancer Nurse Manager at the Cancer Centre in the University Hospital. He became the president of the European Oncology Nursing Society in January 2021 and is committed to enhancing the field of nursing by building together and advocating for innovative care, education and research for the benefit of all cancer nurses.
Hello everyone. 1 year ago, the European Beating Cancer Plan identified if we do nothing, a lot more people will be affected by cancer by 2035. The clock is ticking. Much work needs to be done. My name is Johan Damant. I'm a cancer nurse and EONS president. I don't tell you something new by saying that many cancer nurses around Europe give day by day the best of themselves for all people affected by cancer and their families. As today, cancer care is expanding and become more specialized. Cancer nurses play an even larger and more important role to provide safe and high quality cancer care. Cancer nurses need to continuously advance their education and training. Cancer nurse researchers, educators, leaders, advocates need to continue their important work. From the beginning, founded in 1984, the European Oncology Nursing Society has continuously provided leadership in all areas of cancer nursing. Research, practice, continuing education, communication and advocacy for better support and recognition of cancer nursing across Europe. Why? To ensure that all people affected by cancer benefit from care of highly educated, competent and well-trained cancer nurses. To improve safety and overall outcome for people affected by cancer. We believe you already do incredibly amazing things to support the cancer nursing community, but we are looking forward to many more. Creating more opportunities to build on the cancer care of tomorrow. From today, EONS and the Cancer Nursing Fund will strive to create opportunities, but we can't do this alone. We need your support. Because your support, we can provide more access to education for cancer nurses who don't have, support more cancer nurses to research, to improve patients and their families' quality of life, strengthen the capacity building of cancer nurses in Europe, supporting equal access to innovative cancer care, and support the development of innovative methods of cancer prevention, safe cancer treatment, and patient psychosocial support from diagnosis far into survivorship care and end-of-life care. And there are many things you can do to support this. How to support what you care about. You can advocate for it. You can bring out the word why cancer nursing matters. You can fundraise and events and strengthen the cancer nursing profession. You can tell how to make a donation to the Cancer Nursing Fund. Will support cancer nurses across Europe. Or you can simply share the cancer nursing with your network. All your actions means a lot for the cancer nurses across Europe. Because being a cancer nurse is fantastic, and I'm so grateful to EONS and all its members, stakeholder organizations and the patients' advocates. Because of you, all cancer nurses, including myself, can participate into learning opportunities that neither of us will ever forget, and gives us the tools to provide high quality cancer care during our daily practice. To end and to this new beginning, thank you. Thank you so much for making such a big difference, because every single cancer nurse deserves the best education, because all persons affected by cancer deserve the best cancer care. I hope you will join us. Thank you very much.
Thank you so much, Johan. And now we have some testimonies from some of the nurses who attended last year's conference, EONS 14, the European Oncology Nursing Society, their 14th conference. so much for attending this webinar and listening to the many reasons why we need to support the Cancer Nursing Fund and why cancer nurses are so fundamental to patients and to our healthcare systems. If you would like to support the Cancer Nursing Fund, you can do so by bank transfer, or you can scan the QR code there. You can also find more information by going onto Twitter and searching for the hashtag Cancer Nursing Fund. And then you can also go on Twitter and start and continue the conversation at Cancer Nurse EU. Thank you so much for being part of this conversation and part of this launch. We hope to continue this conversation and continue to discuss the importance of the Cancer Nursing Fund and how we can all work together to ensure that this grows and that every single cancer nurse receives the education and support that they deserve. Thank you so much and have a fantastic day. Goodbye.